Hello everyone, I hope this finds you well. Today we'll cover topic 2, the first part of the presentation. And you as a student is expected that by the end of this presentation, you should be able to describe how to take dental medical history and how to explain the clinical techniques of dental examination. We're also expected to describe the systematic examination of dental patients. Now, for introduction generally, oral health assessment involves comprehensive assessment of a patient's histories and oral health status that leads to diagnosis and risk assessment, followed by personalized care, planning, and ongoing review. So basically, your main aim for assessing a client is for you to come up with a diagnosis and to come up with a way of planning the care of the patient and a standard by which a review can be conducted. Now, when you're taking dental patient's history, of course, the common thing for any history that you take is that you have to have the demographic details. You need to know the full name of the patient, the age, the sex, the date of birth, the occupation, the residence, the religion, and etc. And for your class practice, of course, you will not use the full name, you'll use initials. But when you're in the clinical setup and the patient has their own file, then you will indicate their full name. You are supposed to do the dental history, the social history, and the medical history. Now, there are main symptoms that you should have at the back of your mind before you start even the history taking. Now, one is pain. You need to note the beginning of the pain, the duration that the pain takes. Is it intermittent or periodic? Or is it continuous? What is the intensity of the pain on a scale of 0 to 10? Is it at mild or is it at severe? Now, is the patient having any perverted sensations? Another symptom is swelling. When did the swelling begin? Is there a visible edema? Is there abscess in the swelling? Is there a hematoma? Is it a tumor? Is it at the salivary gland? And if it is there, is the swelling continuous or intermittent? You need to really know the duration of this. If it is tumor, what is it, a fast growing tumor or is it a slow growing tumor? You need to note all this when the patient presents with swelling. Other symptoms that you would notice in a dental patient is crepitation, parchment or crackling, and emphysema. Now, we have various clinical techniques. Some are common to even other body parts, but for the dental one, we have inspection. You'd want to observe if there's a swelling, is there a wound, is there a scar, are there any wrinkles? You want to note the color. Is there any cyanosis when you're observing the oral mucosa? Is there cyanosis? Are there some pigmentations? Are there localizations of maybe things like an inflammation? What kind of borderlines do we have? If there is a wound, is it rugged? Does it have borders that are rugged or demarcated? Now, when palpating, you need to identify the quality of the swelling. Now, is the swelling hard? Is it tender? Is it crepitant? Do you feel some crepitation when you're palpating? Or is it resistant or fluctuant? Now, of course, on palpation, again, you are expected to palpate the lymph nodes. When you are palpating the lymph nodes, you're expected to note the movement of the lymph nodes, if they are normal or abnormal. Now, you should also know the attachment of the lymph nodes. Basically, which area is supplied by that lymph node, so that you know that if there's a swelling, it's basically due to abnormalities, inflammation, or infection of a given region. Now, on percussion of the teeth, you can percuss the teeth and the jaw. There is transillumination. Of course, you do transillumination to see if the sinuses are occluded. If they are not occluded, you'll see the bright light at the roof of the mouth. Now, You also need to know the technique of doing the vitality of pulpodents. Of course, this will help you note the sensitivity of the pulp. Remember, the pulp is where we have the nerve supply. So you should be able to assess it too. Of course, in that, you will be expected to know various strategies for assessing the pulp, and usually the sensitivity test, such as the thermal or electric pulp testing, can help assess the response of a person to stimulus, and it will help in assessing the coldness or warmth of the pulp, and it is the most common way of assessing the pulp, the vitality of the pulp, that is carried out by clinicians. Now, we have a systematic way of examination of the dental patients. Now, the first is to conduct a comprehensive extraoral examination of the patient's head and neck. Now, when you're doing that, you're expected to examine the skin, the facial bones, the lymph nodes, and the temporomandibular joint. In your examination of that, you should be able to note any abnormalities that are present in those areas. Another examination is the intraoral examination of the patient. That will help you identify the oral health status of the patient. Now, in this, you will look at the oral mucosa, the periodontal tissue. You will also examine the teeth. In teeth, you're supposed to examine for the cleanness of the teeth, if it is clean or if it has caries. What is the level of the caries? Is it advanced? If there are any restorations, you also look at the tooth surface loss, any abnormalities of the tooth, if there is any fluorosis or trauma to the teeth. Now, you also need to identify any occlusions or orthodontic needs and identify if there are any dentures that the patient may be currently using. Other assessments would include undertaking appropriate radiographic assessments based on the clinical findings and record details. Of course, patients present with different disorders. Now, depending on the disorder, you will be able to know, or you will be able to identify the kind of test that is needed, or radiograph that is needed. If it is an X-ray, you'll be able to identify that. You also need to use to assess the compliance with preventive advice and the effectiveness of previous treatment. If the patient is known to have had a dental problem and it is a case of follow-up, in the first meeting, probably you had discussed with them on the preventive dental procedures or the preventive practices like brushing, flossing, and even cleaning with fluorinated fluids or liquids. Now, you need to follow up on that and see if they implemented, and if they were on any drug, are there any improvements to the dental health of the patient by the time of the review. Now, you need to record that each element has been completed and record any positive clinical findings from the assessment. In your recording, you modify according to your current assessment. There is the first time you meet the patient, you record, give education and the drug. Then when the patient comes for review, you do another assessment and compare and see if there's improvement or not. Now, these are just a list of modifying factors that you need to have at the back of your mind at the time that you're conducting histories and physical examination of a patient with oral health problems. You should go through this one by one and master them, such that you're able to translate what you find out during history and physical exam. Now, for further studies, you can get the book or go to the site that has been listed in this reference. That is the end of our presentation today. If anybody has a question, you can post it in the class discussion forum and we'll look into it.